Let me start by telling you a story about Derek. Derek grew up in a tight-knit community in Chicago, and he was surrounded by love from his family and from his neighbors. However, as he entered adolescence, his family faced financial hardships due to his father losing his job at the electric company where he had worked for many years. And the loss of his job meant struggling to make ends meet, leading to increased stress and tension within that household. As the economic strain persisted, Derek's access to resources began to dwindle. His father started drinking to cope with the stress, and with only his mother's income, it was challenging for that family to afford fresh, nutritious foods. So instead, they relied on processed foods and inexpensive options available at the local convenience store, which lacked healthy choices. Additionally, Derek's community lacked recreational facilities and safe outdoor spaces for physical activity. So he found himself spending more time with other youth in similar situations, hanging out and doing nothing productive. Despite his academic potential, his access to quality education was also hindered by the underfunded school systems he had to attend because the family could no longer afford private school. Overcrowded classrooms made it difficult for him to thrive academically and further perpetuated the cycle of limited opportunities. As Derek navigated through this teenage years, the cumulative effects of these social determinants began to take a toll on his health and well-being, and he struggled with obesity, compounded by feelings of isolation and low self-esteem after his father and mother decided to divorce. The lack of access to mental health resources exasperated his struggles, leaving him feeling trapped in a cycle of adversity. However, Derek's story is not defined solely by challenges. Despite the obstacles he faced, he found resilience within himself and his community. With the support of a caring state trooper and a local youth program called Police Explorers, he discovered a passion for physical activity again and also community service. And through their guidance and encouragement, Derek began to reclaim his health and confidence, taking small steps toward a brighter future. He eventually joined the Army at the age 18 as a way out. Derek's story underscores the profound impact of the social determinants on individual health outcomes by addressing the systematic barriers to health equity and fostering supportive environments. We can empower individuals like Derek to overcome adversity and thrive. This anecdote highlights how factors such as economic stability, access to health, healthy food, education, and community resources can shape an individual's health journey. Hi, I'm Derek. I'm your TTA specialist for the PTTC. Social determinants of health is personal to me because it forms a complex web of interconnected factors that profoundly influence an individual's susceptibility to substance misuse. This intricate interplay involves a multitude of social, economic, environmental, and cultural elements that collectively shape an individual's well-being and health behaviors. Understanding these determinants is crucial for addressing the root causes of substance misuse. And today, we'll explore how various social determinants contribute to and impact substance misuse. For those who begin to introduce yourself in the chat, please continue. The opinions expressed here are the view of the PTTC network and do not reflect the official position of the Department of Health and Human Services or SAMHSA, and no official endorsement from DHHS or SAMHSA for the opinions here described are intended or should be inferred. Our roadmap for today is before you. We will embark on an exploration of the fundamental concept of social determinants of health. And this foundational session will set the stage for understanding how the conditions in which we are born, live, learn, work, and age can significantly influence our health outcomes. We will delve into the various factors that contribute to health disparities and gain insights into why addressing the social determinants of health is critical for fostering a healthier and more equitable society. Our roadmap is designed to be an informative and interactive journey. offering participants a comprehensive exploration of the social determinants of health and actionable strategies to promote holistic well-being within our communities. We look forward to embarking on this learning adventure together with each and every one of you. Ladies and gentlemen, it is my distinct pleasure to introduce our esteemed facilitator for today's session, Mr. Ben Stevenson II. Currently serving as the Prevention and Harm Reduction Manager for Montgomery County, Maryland, and the proud owner of BES Consulting, LLC. Ben is a seasoned professional with over 15 years of dedicated service in substance abuse prevention. Throughout his illustrious career, Ben has had the privilege of working with thousands of youth, professionals, and parents in communities across the country. His journey has seen him play pivotal roles from his time as the training manager with CADCA to his impactful contributions as a training and technical assistance associated with SAMHSA's CAPT team, where he worked directly with states, providing invaluable training and technical assistance. What sets Ben apart from others is not just his wealth of experience, but his multifaceted approach to substance abuse and substance abuse prevention. Having worked across the continuum of care, including roles in treatment, recovery, and prevention, Ben brings a holistic perspective to his endeavors. His passion for developing and facilitating prevention programs for both youth and adults underscores his commitment to creating lasting, positive change. Originally hailing from Winston-Salem, North Carolina, Ben holds a bachelor's in political science and a minor in history from North Carolina Central University, in Durham, North Carolina. And he further enriched his knowledge by earning a master's in marriage and family therapy. Ben's dedication to his field is exemplified by his certifications, starting as a substance abuse prevention consultant in North Carolina and currently holding the esteemed title of a certified prevention professional in Maryland. Notably, Ben's commitment extends beyond his professional achievements. His role as the former Western Region representative for MAPA, the Maryland Association for Prevention Professionals, reflects his advocacy for the field and his dedication to fostering collaboration among professionals. So join me in extending a warm welcome to Mr. Ben Stevenson II, whose passion for prevention and promoting healthy lifestyles continues to impact communities nationwide. We eagerly anticipate the insights he will share with us today. And without further delay, welcome, Ben.
All right. Thank you, Derek, for that warm introduction. I could not have said it myself better myself, and I was hoping you would abbreviate it, but you definitely went into detail. So the challenge of following behind you is upon me. So good afternoon, everyone. Again, my name is Ben Stevenson. Definitely a pleasure to be with you today to try to articulate as best as possible this very important topic as it relates to our field of prevention. So for our learning objectives today, we're going to describe the profound impact of social determinants of health on substance misuse, and of course the pivotal role we play as prevention professionals in addressing those social determinants. We're going to identify intervention points for prevention professionals. So we're going to look directly at our work in prevention and figure out how we can intervene in addressing some of the social determinants of health in our communities at the community level. And then we're also going to identify a list of evidence-based, substance misuse prevention activities that can help to reduce some of these social determinants of health in our communities and address some of the health disparities that we see as well. All right, so looking specifically at our first objective for today in regards of addressing the profound impact of social determinants of health on substance misuse and our role in it, we first must identify and discuss, what the social determinants of health are. So in prevention, we talk a lot about the social determinants of health, which initially was derived from Healthy People 2023 initiative. Social determinants of health, of course, are the economic and social conditions that influence individuals and group different, differences in health status. So their absence, of course, is directly, tied to health disparities in our communities, and if they're not present and robust, they represent, community risk factors. So looking specifically at education access and quality, what are some examples of education access and quality that could be viewed as a determinant in our community? So looking specifically at this social determinant, we can look at graduation rates as an example. We can look at the availability of preschool programs in our communities. We can look at access to affordable, colleges and trade schools as well. But we can also look specifically at access to behavioral health services in schools, particularly looking at the services we provide in prevention. Um, Now, as we look at our next determinant, and there it is. It popped up. So looking at healthcare access and quality, what do you think some of the examples of this determinant may look like? So I see. Lauren said transportation to schools. So looking at the previous determinant, equitable discipline practices, transportation in rural areas, exactly. So transportation to um, quality health care is important. Access to mental health care is important. So these are some definitely some great examples. Access to emergency services, distance from home to the nearest hospital, which are great examples. And then as we transition to our next determinant, looking at neighborhood and built environment. What are some examples that fall under the neighborhood and built environment that could be viewed at sidewalks? Yes, that's a great example. Recreational opportunities are another example. Bike lanes, yes. Clean parks, street lights, safe places to place. Yes, these are all great examples of available water, available to clean water. Exactly. So these are some other examples. And then looking at our next one, looking at social and community contexts. Um, Looking at social and community contexts, what are some examples of this? So sense of belonging, yes. Do we believe in mental health? Right. So lessening that stigma around mental health in our communities. High density of liquor establishments. Trust in neighbors, yes, great examples. Diversity of leadership, I think is an important one as well. Amber added churches, service activities. Food deserts, yes, is a very key piece to this as well. Availability of community programs to build promote protective factors in the community. So religious hostility. Thank you, Colton, for sharing that as well. And then looking at our last determinant, economic stability. What are some examples here? So housing, yes. So rates of homelessness, equal pay, livable wages, jobs, great examples, legitimate job opportunities, um, availability of affordable health care. I recently became a grandfather, which I know I look very young to be a grandfather, but looking at childcare for my daughter's son has been eye-opening in regards to how much childcare is these days. So access to professional development and growth are great examples. So thank you for indulging in that conversation with me around these different social determinants and what falls up under there. So looking specifically at, so we know that of course social determinants contribute to health disparities, and then when assessing like the needs in our communities, we must first consider these factors and determine which have the greatest impact on substance misuse in our communities. So when Derek shared his story about his life and clearly identified some of those social determinants, some of those could be risk, directly related to risk factors in regards of someone moving in the direction of substance use. And then we know that sometimes when we look at structural disparities, these impact a lot of the underserved populations in our communities are populations who have historically been marginalized. So we must always keep in mind those underserved or historically marginalized populations, looking at the African American population, the Latino population, our tribal nations, the LGBTQ plus community, our Asian Pacific Islanders, all of those different populations we must consider when conducting needs assessments in our community, needs assessments in our communities to ensure that we're capturing the clear story of the entire community. So looking at the influence of the social determinants of health on substance misuse, we know that the social determinants have a profound impact on overall health and well-being. And I think when we look at the spectrum or the continuum, which a lot of people refer to it, when you look across that entire spectrum from promotion all the way to treatment, we know that the overarching goal within that spectrum is always promoting overall health and well-being for all, whether it's a group of people all the way down to the individual. And so, as we look at these influences of social determinants of health on substance misuse, we can look specifically at some statistics that share and articulate these definite connections. So, looking specifically at economic stability, SAMHSA did some research around how individuals with low income levels may have a higher risk of substance misuse, and it's related to those economic stressors and the instability that contribute to using substances as a coping mechanism. And then you can also look at the social environment. So looking at various studies, individuals with strong social support networks are less likely to engage in substance misuse, and we can definitely attribute that back to Derek's story when he shared about those social supports that he had to try to help him navigate through life and things like that. Also looking at cultural factors. So we know that substance misuse rates can vary among different cultures and ethnic groups. So knowing that cultural competent, or I even like to say cultural proficient, prevention and intervention efforts are crucial to addressing these disparities. And then also looking at it from a psychosocial factors. So SAMHSA also highlighted the connection between mental health and substance use, and we know that there's a lot of synergy and connection between persons dealing with mental health challenges and their susceptibility to engaging in substance misuse. So emphasizing the needs of integrating care and supports for individuals who might be dealing with both of those, mental health as well as substance use. And
So,
also, as we look at the multiple contexts, we can look at how the social determinants can, be uh, viewed from the multiple contexts. So we know that the multiple contexts derived, of course, from the social ecological model. And this is something we use in prevention in regards of identifying the different levels of risk factors, but also ensuring that whatever interventions we implement, we are implementing them across these different levels. And then we understand and know that this is helpful for us in regards of understanding the root causes as it relates to health disparities.
so
So,
Ben,
oh,
just
go
want
ahead.
to ask you, at the
Yes.
individual level, then looking at this multi-context of the social determinants of health, what's important for us to look for when it comes to individuals?
Yeah, I believe that looking specifically at individuals, we want to look at any traumas they may have experiences, the helping to build up resiliency or perceptions of risk when it comes to substances, making sure that they have knowledge of public health services and even harm reduction services from the individual level. So looking at trauma specifically, that takes us back to that discussion around ACEs, adverse childhood experiences, as well as PCEs, which are positive childhood experiences.
What about at the relationship level or the interpersonal level?
So at this level, we want to look at substance use identification and prevention education. Also looking at access to peer support, family support, as well as looking at the family history of substance misuse. So sometimes we forget to look at is there a history of substance misuse in that family, and how can we wrap services around those persons.
What about at the community level when we get there, where most of us work?
So at the community level, we want to ensure that we provide access to culturally specific providers, peer networks, and behavioral health services. So in the community that I work in, there has been a challenge in regards of trying to identify and recruit um, persons who are bilingual. And so making sure that you have persons in communities that look like individuals that are being served is crucial to their success. Prescriber perception of risk and prescribing practices could also be viewed under this area as well, making sure that prescribers are aware of the dangers of substances, but also aware of proper prescribing methods when it comes to opioids specifically, and even looking at public health and harm reduction programming. So ensuring that there is a continuum of care or an array of services that can meet people where they are, uh, regardless whether they're at the pre-contemplation phase or whether they're ready to transition into treatment, which of course we know in prevention, that's where our work stops. We make that referral in connection to a treatment provider.
What about that outer ring, that societal ring?
Yes. So looking specifically at societal, this is where we do a lot of our work around stigma. So stigma is a key piece here towards people who use drugs. And so I know in the harm reduction space, they're doing a lot of work in regards of trying to reduce the stigma, but also meeting people where they are, providing non-judgmental and compassionate services and things like that. But also policies that promote, racial and health equity. Here we can definitely in a prevention space advocate, because that was something Derek had mentioned earlier, the advocacy piece of our prevention work. And then also looking at health insurance coverage for mental health and substance use as a key factor here as well. One point I want to leave you with as it relates to the multiple contexts and social determinants is that when looking at substance misuse prevention, we know it can focus on a single level of the multiple contexts, but interventions that work across levels are more likely to be successful in preventing substance use. So when discussing the social determinants, it's, of course, it's a common practice to talk about upstream interventions as well as downstream to refer to the levels of the multiple domains or multiple contexts. So just wanted to leave you with that point.
Thank you.
All right. And okay. All right. So looking at social determinants of health and substance use risk, we know that our health and well-being are shaped by many factors, some of which have, traditionally been outside of the healthcare system. So these include conditions that, of course, make up our social environment, our economic environment, as well as our physical environment. So the social determinants of not only affect our physical health, but also impact the person's mental health and their misuse of alcohol and other drugs. So thinking in terms of like neighborhoods with low rates of economic stability are significantly associated with increases of rates of substance use among residents, even after controlling for individual economic status. So even if you do the work to help impact or individuals' economic status, the community at large is still at risk because of the economic challenges that community is experiencing. And so research attributes these findings to the increased stressors, which we kind of already talked about a little bit, the high levels of the psychological distress that people experience or communities experience, and then the decrease in availability of social resources. So addressing those social determinants of health allow us in prevention to better target the root causes of substance use, because it could be definitely attributed to the environment in which people live. And so we know that, of course, social determinants are also among the primary driving factors around health disparities and inequities. And so when looking at populations instead of individuals, the social determinants, of course, are those root causes of those health disparities. So when addressing, it gives us in prevention a better understanding of these vulnerable populations who we're likely engaging with in regards of substance misuse and prevention education and those who are experiencing these negative consequences.
So essentially, I mean, it's bigger than the individual in that community. It's about the environment and we have to have impact on the environment. And just to try and give like a few examples, I think what I'm getting is like a neighborhood with many families living in poverty has low economic stability, and a school
Yeah.
district with limited transportation options have low educational access. Can
Yep.
anyone else give any other examples in the chat?
Yeah. Uh, yeah. A neighborhood with high gun violence, is an unsafe built environment. Is another example. Um, the lack of social connection within the community. So, which is maybe related to child bullying. A lot of people don't even think of childhood bullying. Rachel shared neighborhood with multiple smoke/vape shops.
Mm.
Rise in crime. Yeah, I think a lot of us are even a lot of states are experiencing with legalization of cannabis with the increase of cannabis shops in their locales and things like that. So, and Kara said food deserts. Mecca said no walkable and food deserts. So yeah, those are definitely key issues.
So even though the social determinants of health use like new language as the idea, but the idea still remains the same. And that is the overarching goal is promoting overall well-being in our communities. And prevention and public health have always needed a paradigm for the complex web of factors that influence health and behavior. So like you've discussed already, in multiple contexts of risk and protective factors, we have to remember these broken down into four levels. And again, that's the individual, the relationship, the community, and the society.
Yeah, yeah, exactly. And then we also, a lot of us are familiar with those terms that I've already mentioned, the ACEs and PCEs, and ACEs are actually considered a social determinant, and of course are directly linked to risk and protective factor framework, which we use in substance use prevention to do our work. So we know that there's a definite connection, and the work we do in substance use misuse prevention that you know we ensure that we are seeking to address those research-based risk factors, and looking to increase protective factors because sometimes we want to make sure that any risk factor where we're looking to address is tied back to some research that can be found and utilized, and then also making sure that our prevention services are culturally specific and trauma informed, can help to reduce health disparities and improve access to appropriate treatment. So just like I was speaking earlier about how we know on that continuum or the spectrum of services, our work stops at that indicated population. And when we understand or connect with someone who is ready to pursue their treatment and recovery, we can make that direct referral to those services. Yeah, great. Okay. Every time I click, there's a little hesitancy when I click through, but that is okay.
Have
All right.
faith.
So, so we know that the social determinants of health resources play a crucial role as protective factors. So when we talk about those resources, we talk about equitable access to social determinant of health resources can act as a protective factor. And of course, it takes us back to that overarching goal of the pursuit of overall health and well-being for our communities. So we want to ensure that their impact is definitely significant when they're equally or equitably accessed. And that can help to reduce reduce health disparities in the community in regards of supporting those in the community. So thinking in specific of, a model that could be an example of this, we can look specifically at the Handle with Care model that has been shared or implemented in a lot of different places in which fortunate enough we're currently implementing it in the state of Maryland, which of course a law enforcement officer, when they encounter a child who might have been exposed to a traumatic incident or violence, they alert school personnel and other supports to try to just basically say handle with care. They may not share details of the incident, but they're gonna, alert those persons that this child has experienced some kind of traumatic issue to try to wrap around supports for that child throughout, their time. So, uh, that is an example of, providing equitable access to dealing with a social determinant as a protective factor because um, in prevention, we talk a lot about how, a person might have, many, many, many risk factors, but that one protective factor can potentially mitigate a lot of those risk factors and help propel a person to hopefully achieving and their ultimate potential and things like that. All right. Also looking at other examples could be, education. So ensuring that quality education is available to ensure individuals have knowledge and skills. So thinking in specifically of prevention, equipping young people with the knowledge of about substances, about coping skills, about those other different strategies to help build up resiliency and skills with them are important. So ensuring that, we're providing equal access to these, quality education avenues ensures that individuals from all backgrounds have tools within their toolbox to navigate, the challenges that they may experience. And also looking at media influences as well. We utilize a lot of media campaigns within prevention as avenues to educate and bring awareness, and also increase knowledge. So ensuring equal access to positive and culturally sensitive media campaigns is important. We may have funds to create a media campaign in English, but if we have a large Latino population, we want to make sure that we're able to translate that material, make sure it's culturally sensitive and inclusive of those of that population within our communities. So, if in summary of this, if the presence of social determinants of health resources acts, of course, as protective factors against substance misuse, when they are accessible to all individuals in the community, not just a certain group, but all individuals. And so equitable access is key to leveraging the full potential of these resources, ensuring that we're able to build up those protective factors in our communities and make sure that they are universally available and contribute to building resiliency, not only just for individuals, but for our communities at large. So efforts, to reduce health disparities in access is in access to resources are integral to fostering positive, healthy outcomes for everyone.
Ben, you talked
Yes.
about media influence, and Mallory asked, do you think access to the digital space also has an impact on substance use risk?
I definitely agree with that. Feel it does have an impact because um, if you think about the access to social media and all these different avenues, they are, sometimes perpetuating messages that are not necessarily accurate. And they are definitely influential. You have all these influencers and all these different people sharing different things, but they may not have the clear understanding of the science or knowledge. And, young people can be very influenced through that, right? Through their peers. So I think sometimes for us, trying to counteract that message, because of course we all have limited budgets when it comes to media and things like that, and we know how expensive, that kind of thing, marketing can be. It could definitely act as a risk factor, and so it could pose challenges for us to try to, counteract that message. So thank you for that question. All right, and I'm clicking. All right, there we go. All right, um, so looking at our role of as prevention professionals, when thinking about this conversation, it took me back to really looking at the prevention professional code of ethics, because I kind of felt like that is a document or a place that's really guiding us as professionals in this work. And so, we are charged with following, of course, six principles, non-discrimination, competency of our field, integrity. But I want to key in and focus in on the sixth principle, which focuses on our ethical obligation for the community and society in which we serve. And so I feel like this principle tells us that we should be proactive in regards of for public policy and legislation that directly links to the wellness and welfare of individuals and also just the communities at large in which we serve. We should educate the general public and policymakers on factors that, of course, are impacting health. As we, our goal and part of our job is promoting health and overall well-being. So this basically states, that every person has an opportunity to attain their highest level of health, in regards of advocating for them. And we know that, that greater influence of health, um, it can be the social determinants of health beyond just genetics. A lot of us, a lot of times we fall on that genetics or access to healthcare services, but if we can address these greater influences around the environment, we can have a huge impact on the community in which we serve, and where we're working to decrease, these disadvantages that are preventing someone from reaching that potential based on their social position or circumstances. you know, we're following within our ethical guidelines as prevention professionals, and we're charged with, of course, speaking out against some of those inequities that we may see in our communities.
Excellent point, Ben. So in summary, objective one, essentially, based on what we've discussed so far, we can see the impact of the social determinants of health on substance misuse. And as we looked at the 5 key components, again, education access, healthcare access, economic stability, neighborhood and built environment, and social and community context, we can see how the influence that could have on individuals and group differences in their health status as well. And we've also identified the link between the social determinants and the multiple contexts and their overlap. So we're also looked at the role of prevention professionals and how our work is a key place in addressing the health disparities that are present in our community that we all care so much about. So the question I guess I give to the audience at this point is, do you believe is the connection of the social determinants of health to substance misuse risk and protective factors based on the information that you heard so far in your experience? What is the connection of the social determinants of health to substance misuse risk and protective factors? If you can answer that in the chat. Support systems, okay. Increased protection, yes. I think Ben made one point very clear that you could all walk away with, and that is the absence of social determinants of health indicators represents risk factors. The absence of the social determinant of health risk. So essentially, like if it's not being done equitably and it's not being done at all, if you're not having equal access, then there's no equal access. So some risk factors are major issues such as access to health care. And we hear that in the news all the time, or the quality of the schools. While it may not be possible to change these given the available prevention resources, it's necessary to acknowledge them and to advocate for change. And I think that was the last key point that he made with us. We have an ethical responsibility to advocate for change. So health and well-being are shaped by many factors beyond healthcare, including conditions that make up our social, economic, and physical environment. And the social terms of health not only affect our physical health, but they also can have an impact on a person's mental health and their substance use behavior as well.
All right. Thank you for that summary, Derek. So as we transition to our second objective for today, looking at the intervention points for prevention professionals to address the social determinants of health, I want to ask you a quick question. So when you're traveling and you're, in the car, do you use any apps like Waze or Google Maps and things like that? And if you do, what types of information do these apps provide you as far as trying to help you get to your destination? Oh, yes, Heather, delays. Robin said detours, accidents, traffic information, real-time
Yes.
information. Yes. Cops. Yeah, oh yes, cops, speed traps, tolls, all this, gas stations. Where's the local Starbucks or Dunkin' Donuts or something, or whatever coffee shop you would like to go to. Food places, yes. Protesters in the road. Wow, I didn't even know that it shared that. I haven't seen that one. Yeah, okay, all right. So when thinking in terms of our work, right? In prevention, we utilize, of course, the strategic prevention framework, which, of course, within that framework, we utilize logic models or roadmaps. And so when thinking of addressing, like the social determinants of health, we want to always utilize a roadmap to help guide our work. And so the CDC put out the health intervention points framework. And then we're also going to look at the county health rankings model, and try to bridge the connection with our work in prevention as additional resources to help support us. And yes, Sheila and Lauren, it does share the ETA of when you're going to get there, right? How soon you'll get to your destination. So thank you for indulging in my question there. All right.
Well, the social determinants of health intervention points. That's what we need now. And luckily, because health equity is a priority for the CDC, the agency has taken multiple steps to ensure that efforts to address the social determinants of health are built into the agency's work and not confined to a single program. So CDC, at their center or public health topics, this is one of the models that they're using now. And we wanted to share this with you as a tool for you to use also. This came out in fall 2021, and CDC leadership started an agency-wide process to build and expand cross-cutting efforts to address the social determinants of health. This effort was led by the National Center for Chronic Disease Prevention and Health Promotion and resulted in a framework of these 6 pillars. And you can see them clearly here that the data and surveillance pillar, it's embedded a consistent social determinants of health approach to standardize collection, analysis, and dissemination of data across the agency. We can do this. Evaluation and evidence building to advance evaluation and build evidence for strategies that address the social determinants of health to reduce disparities and promote health equity. We can do this. Community engagement, to foster meaningful, sustained community engagement across all phases of intervention planning and implementation. Guess what? We can do this, and the infrastructure and capacity to strengthen and sustain the infrastructure and the policy and law to identify evidence-based tools and resource to enhance community and policies that affect the social determinant of health with policymakers. And that's part of the work that we do already. So CDC is using this framework to help their agencies and leadership make decisions about where to invest the social determinants of health resources. And we're sharing this with you. So also, as you're working at the state level in order to do this work, you understand that this is there as a tool for you, and also that equity is right there in the middle. As we try to address these conditions and we put laws in place and we start collecting data and try to encourage community engagement, we ensure that equity sits right there clearly in the middle of the work that we do.
Yeah. Yeah. So as Derek was stating, as you look at that model, you could possibly look at the strategic prevention framework right beside it and see exactly within those 5 steps how the model from the CDC can be blended, because there's definitely a lot of overlap in regards of the work we do in prevention and what they're proposing to do within the CDC as well. So this is another model we wanted to share that comes from the county health rankings model, which basically, of course, illustrates the many factors that, if these factors were improved, can help many communities become healthier places to live, work, and play. And then also looking at policies and programs at the local, state, and federal levels and how they play an important role in influencing these factors. So by implementing, of course, evidence-based strategies that focus on specific health challenges of a community, there's an opportunity to influence how long and how well people live. So looking at, a wide range of policies, programs, systems and environmental changes that can make a difference locally, we could, some interventions, of course, focus on individual behaviors. They can influence dietary choices. So a lot of you spoke about food deserts. And seeing, I think an opportunity is figuring out a way to couple uh, um, addressing the challenge of food deserts with prevention, education, and awareness. Figuring out, looking at exercise levels or alcohol consumption. And other strategies can tackle systems and structures, looking specifically at enhancing, opportunities for education or stimulation of economic development, as well as increasing neighborhood safety. So no single strategy will ensure that everyone in the community can be healthier, but many policies and practices in the past that have marginalized groups of people and residents um, can be you know transitioned to are impacted in a way that everyone has access or is equitable access to addressing some of these social determinants. And so this image here is actually a clickable link. So I believe they might put it in the chat box, or we're going to share it later, but you can go to this county health rankings model website and plug in a few key tips about your community, and it will give you strategies and ideas of how to address some of these factors within your community. So as you look at this model, what are some areas in which preventionists do you think preventionists can actually have an impact? So looking at the examples to the far right, what are some example areas that do you think we might be able to have an impact? Family, yes, family and social supports, health behaviors, yes, community safety, yep, yep, water quality, yes. So health behaviors. I worked in a community who wanted to address, the non-medical use of prescription drugs, and one of their key players that they brought to the table was the water waste management people, because they had a vested interest in making sure, of course, the water was safe in the community. So they wanted to promote and push, safe storage and disposal of medications to prevent them from getting back into the water supply. So it's a great example. Um, yeah, so water, housing, and transit can be other areas that we can impact and have possible connection. So eventually it will click for me. There we go. All right. So looking specifically at intervention points for prevention professionals, looking at some of the things that we already do in our work, and kind of can expand upon. So the CDC kind of speaks about all of their work around convening national conferences and webinars and collaborative publications and things like that. And convening is basically bringing the members together and organizing to identify local concerns. So we already do that with our, coalitions in our communities, but maybe it's expanding or thinking outside of the box in regards of membership, and bringing those other key players that might be addressing social determinants of health in the community, and figuring out a way that there's to connect and bring some synergy. Also integrating, looking to collect, data from multiple resources that we might not normally look to collect data from, whether it's looking at, GIS maps for community needs. So looking specifically at, maybe a GIS map that shows the lack of, healthy food options, or shows alcohol outlet density, or shows different things that can impact the community. And then also utilizing, the CDC has a platform called Places, CDC Places data, which shares information about the environment and things like that. So utilizing those types of resources, and then influence. leading approaches to, developing policy and solutions, and leveraging funding, to help address mechanisms and implement different actions and things like that. So a prime example that I shared was the handle with care. So advocates from across the state came together and advocated to the governor's office and advocated to different places to try to influence the implementation of the handle with care model within the state of Maryland. And then another example of this is when former CDC director Rochelle Walensky announced that racism is a public health threat. So that kind of reinforced actions that communities were already taking, and supported many others that they could take some additional subsequent actions to address these issues in the community. So also looking at some school jurisdictions in which I work with, who implemented Narcan policies within their within their school district. Initially, it was students weren't able to carry Narcan in schools, and they reworked the policy to ensure that just in case they have a friend or something like that that is dealing with opioid use disorder, they can have or carry Narcan to help save a life, and learn and utilize that life saving practice. All right, so mainly, really contributing to like big changes as well, whether it's implementing a you know policy or ordinance in our community. I think someone spoke earlier about prohibiting flavored vapes and e-cigarettes and things like that. And a great example of that is what they did in the city of Los Angeles when their city council voted unanimously to ban the sale of those types of flavored tobacco products. So we could definitely utilize examples from across the country that can help support us and guide us as we move forward.
So when we
So,
think about
go ahead.
like the spiff, like you talked about earlier, and building capacity, how can we use that same step to address the social determinants of health?
Yeah, so we know that that second step, the spiff, as far as building capacity, is directly related to trying to identify those key players and key partners within the community. So when you're identifying a specific presenting problem in the community, you want to make sure that your community partners are directly connected to that presenting problem. So if you're looking to leverage resources to address the social determinants of health, because you know that is influencing the substance misuse problem, then you want to make sure you identify those key players and partners within the community. So when you look at leveraging these resources, who are some community organizations in which you would work within your community to try to leverage or address the social determinants of health?
For example, if you're trying to address like uh, domestic violence, what you can put into the chat box, what groups would you contact within your community?
Shelters, women's shelters, food banks, city hall, YWCA, the Haven House, Crisis Center,
Get it.
behavior health care. Yes.
And if you're addressing substance misuse and you want to, your focus is prevention, who would you contact besides yourself, who would you contact within your community to help you with that?
Yeah. Wendy said me.
Right. Besides yourself, Wendy.
Yes. Libraries, detox facilities, yes, crisis professionals, local health care. I would even say the recovery community. Yeah, peer support, mayor's office. Maybe they run a task force organizing institutions in each town. Yes, health departments. So these are definitely great examples. And then you also want to look at, of course, I think it was mentioned like your state, tribal, county, local governments, also looking at your educational institutions. If you have a local college or university or trade school close by, that could be a partner. Also looking at healthcare, whether it's a major hospital or other smaller medical practices and things like that. And in thinking of this topic here and addressing these social determinants, you want to make sure that when we're increasing that community support in programs, we want to make sure that the program partners have actionable tasks for the partners, as well as agreements where they participate in, an advisory capacity. So, for me, when I do recruitment for my local coalition, I don't necessarily say, "Hey, will you join my coalition?" I typically, and I've learned this practice from one of my colleagues, which it has never failed me since I've been implementing it. But I would ask them to come to 3 meetings.
Yeah.
And then after the third meeting, I would ask them their opinions on the group and how they feel that they could fit in and then share, and then I would share with them why I invited them and why I feel they would fit in, and leaning on their expertise, because sometimes they may not necessarily see it themselves, but somebody else sharing it with them. Your community partners can offer their expertise. They can, it helps to demonstrate transparency. So the sharing of data, and building those different points of sharing evaluation results and things like that, um, uh, helping to establish action plans that they can be involved in, and sharing responsibility for planning and implementation. I think sometimes in prevention, we feel that we must do it all ourselves, but for us to really survive and thrive in the work that we do, we must build up these collaborative partnerships and relationships. And then also ensuring cultural inclusion. We speak a lot about ensuring that we have the focused populations involved in the process from the beginning, and we want to make sure that we are including them. And then, of course, clearly understanding like the roles and environments, um, and expectations within the network, and of course attending meetings and things like that. So what do you think the connection to is between the social determinants of health and behavioral health resources and resource gaps? What do you think the connection between the social determinants of health and behavioral health resources and resource gaps are? And yes, Bill, nothing about us without us. I love that example.
Well,
Um,
I would have to say, Ben, that resources that enhance the quality of life can have a significant influence on behavioral health in a community if there is equitable access.
Yes, totally agree. So so access and making sure it's equitable. Molly said resources reflect the health of our social determinants of health. So making sure that we have the equitable resources or access to the equitable resources is important. Charmin said stigma and access, need for communication, compassion. So all of these are great examples and ideas that are definitely connected to making sure that we recruit and identify those community partners that can help us, leverage these resources and address these resource gaps. Um, so thank you for sharing that insight.
So as we finish objective 2, I guess I'd like to leave us with, as we talked about social determinants of health and those intervention points. You guys were very active in letting us know, like, that you clearly understand those intervention points. And we showed you what the CDC is doing, their approach, and also the county health ranking model. But I'll leave you with this. There's no power of change greater than a community discovering what it cares about. There is no power of change greater than a community discovering what it cares about. And that's where the most important intervention point is for us as preventionists: learning our community, knowing our community, and understanding and making them and understanding what they care about, and then intervening there.
All right. Yes, definitely understanding and knowing our community. I kind of feel as a prevention professional, we're viewed as experts on the process. We're experts on the process, but definitely the community is the expert of their conditions and what they're experiencing. So moving on to objective 3, looking at evidence-based substance misuse prevention activities that can reduce social determinants of health disparities at the community level. So we know in our work it's important to follow the science, right? Making sure that what we're using has been proven to be effective. Um, so it's important to, identify those evidence-based interventions to address the needs of our community. So when looking at are looking for evidence-based interventions, it is important for us to consider whether there's an evidence of effectiveness for an intervention is either weak or strong. We know that interventions that have shown to weak have been harmful to communities and things like that. So we want to pursue those that are strong, given that they have strong evidence. And then we know sometimes that it is difficult for us to find interventions or strategies that clearly can be utilized with indigenous populations and things like that. Looking at like our federal registries and peer journals, but looking at like cultural traditions or practices, may provide important information about that, about what may work within those particular communities as well. And I know the PTTC has, done a lot of work around sharing lists of registries for interventions and things like that. So I would definitely encourage you to take advantage of checking those out because they allow you to query down to specific populations that can be, are different populations in which you can utilize those strategies with.
So the social determinants of health are a big problem. We all accept that. And they can be intimidating. But many of the social determinants of health are vast societal issues, which may require larger scale mobilization and even legislative solutions. But prevention still has a role. And I think we understand that clearly now, because prevention organizations, we have the power to focus on more manageable components of the problem. So in the chat, I just asked you to answer that question. How can substance use prevention address something as massive as the social determinants of health? And understand, you have a role to play. A small prevention organization need only resolve access to education in their community, but understanding which established prevention interventions can address the social determinants of health can be an important part of planning. For example, implementing an evidence-based school or classroom-based prevention program designed to improve school climate can help address both education access and quality and social and community context. So you have a big role to play in this global problem. Preventionists can also partner with other interest groups, as we talk about, to address bigger problems. So when attempting to influence the social determinants of health, remember that prevention is a piece of a large effort. When I was working on the ground level in Arkansas, and we were dealing with partnerships for success, one of our key partners was the Boys and Girls Club. They were already offering access to resources and social in a social context to youth, and us partnering with them enhanced the work that they were doing, and it also expanded the audience that we were reaching as well. So the H in the social determinants of health is health, which includes all aspects of health. Interest groups from across public health may be interested in the same issue you are. So I say that to say prevention professionals can be one voice among many collectively working for causes such as supportive housing or employment or healthcare or services in underserved areas, and the efforts to combat racism and discrimination. You have a voice, and I encourage you to use it.
Yes, so thank you. So looking specifically at strategies to address the social determinants of health. So we know, various strategies have been implemented across the national and state levels, and we're going to look at a few of these, but that could be implemented, of course, at the local level. But it definitely goes back to what Derek was saying about building that collaborative connection for preventionists and others in the community that are working to address the social determinants of health. So looking at these strategies, key to relationships with social service providers. So just for the sake of discussion, who in here has aligned or connected with the social service providers, maybe providing a prevention program within their social service setting? Whether it's a youth program or a parenting program or something like that. So that's a definite connection in regards to helping to address those social determinants of health. So looking at those potential collaborative relationships can be beneficial to us as preventionists. And also, it gives us that opportunity to encounter youth and families who may be in need of the additional supports outside of just our prevention program. So connecting them with those direct social supports, and then also sharing of data with that social service provider as well. Then also looking at our data collection. You know, we always talk about the conducting a needs assessment in our step one of the strategic prevention framework. And so ensuring that when we're collecting this data, that we're looking at the social determinants within our community and including that in our needs assessment to figure out if there's a direct connection between the social determinants and substance misuse in our community. Is it a contributing factor to the present substance misuse problem? So utilizing those experts, epidemiologists and others, groups that collect data and compiling all that into one. I will never say that I am the needs assessment evaluation guru, but I definitely connect with the right people to try to help support and ensure that we conduct a needs assessment that is holistic and tells the story of the community. And then also providing training on the social determinants of health is a key piece. Some people might not be aware of the concept of the social determinants, and we want to make sure that the community is aware of these concepts and raise awareness about the social determinants and how the community can play a part in impacting their relationship to substance misuse. And then also looking at social determinant incentives. You know, a couple programs that I was able to identify when we were doing the research for this is looking back at, you know, backpack food programs are a great example of programs that address the social determinants for families, you know, providing free groceries for, you know, weekends and school breaks. So maybe partnering with food banks to provide a, you know, educational or prevention education opportunity, but the incentive of attendance is getting the free food bag. Could be, you know, a definite direct connection there as well. And then also looking at, you know, just like you know, a kids free ride program. So one community put together a kids free ride program to allow students to ride, you know, public transportation if it was available to get to, you know, other, you know, services and programs within their district. So other things that other strategies that could be included could also be like social determinant screenings. So if you're doing some kind of screening within your program, adding a question about the social determinants of health, dedicating staff to looking at or exploring the social determinants in the community, um, adding a social determinant of health performance measure within your evaluation within the work that you're doing, or even collection and reporting on social determinants of health information. So, what do you think the direct connection of social determinants of health is to health equity? What do you think the direct connection is of social determinants of health to health equity? What do you think the connection of the social determinants? What is the connection with social determinants of health and health equity? Representation. So receiving food from most food banks or backpack programs cannot be conditional. Right. Right. So making sure that, um, you know, these services are provided, and we continue to say this in an equitable manner, that everyone has access to these services, regardless. In any, you know, place where services are absent, is of course indicated as a health inequity.
Right.
So looking at those food deserts and not having healthy foods available is a health inequity. So highlighting that and bringing that up in our communities is important to ensure that you know, people understand that we need to address these issues to try to build up protective factors around the communities in which we serve. Okay. And then also looking at some actionable strategies to address the social determinants. So understanding and addressing the complex connection involves adopting a holistic, multidimensional approach to prevention and intervention. So effective strategies should be considered not only at of course, the individual level. So this takes us back to looking at the multiple contexts, but also looking more at a broader socioeconomic and environmental context that shapes patterns of course, substance misuse within populations. So we want to look at addressing substance misuse at the community level, and we know it requires a comprehensive and a collaborative approach. So going back to I think what Bill said, nothing about us without us, but also making sure we have those key partners at the table to address some of the issues in our community. So looking specifically at the actionable strategy of community education and awareness, this step could include conducting, community-wide awareness campaigns to educate residents about the risk of substance misuse and available resources. I know sometimes in the communities that I serve, we sometimes people, well, I always get the response, well, I was not aware of that service. I was not aware of that. And us thinking that we've done this amazing job to educate and bring awareness, but you always get those few, oh, I didn't know we did that. All right, I didn't know we had that. So it's a constant, constantly have to do that work to educate and bring awareness to the efforts and what is going on. Then also implementing school-based prevention programs to educate students about the consequences of drugs. So utilizing some of those evidence-based interventions like, life skills training and other curriculums and things like that to build up education and awareness. Uh, uh, Dr. Ina shared, we use peer-to-peer models to educate our university students. In a community I work with, we built up a youth ambassador program, which is utilizing youth to educate their peers. So we're training the youth about the dangers of substances, about coping skills, about resiliency skills, and they're training their peers on this. We also have trained them on we've trained some of the youth ambassadors on being Narcan trainers. So they are actually able to train their peers on identifying the signs and symptoms of an overdose, how to respond, and how to administer Narcan in the community. So utilizing them um, is a great resource. Also looking at promoting access to treatment and recovery services. So ensuring that people know or are aware of treatment services is a practice of prevention, is making them aware of the resources that are available in the community. Community policies and enforcement strategies are key pieces which, build in collaboration with law enforcement to implement, community policies models focused on prevention and intervention. Um, no understanding, of course, we can't arrest our way out of a problem, but we have to, start from prevention to address these different issues. So, exploring diversion programs outside of incarceration with law enforcement. And I think Dr. Enna already shared about the youth engagement and mentorship programs. I think these are key in regards of building that peer-to-peer model to ensure that youth are receiving the message from someone that looks like them. I think is important because I love talking to young people all the time, but I think the message will be portrayed and received better if someone is around their age. Making sure that we have culturally tailored interventions, I think is a key piece. So developing, culturally sensitive prevention programming, making sure treatment programs are culturally sensitive and inclusive and able to address the needs of unique populations and diverse people within the community, and also collaborating with our community leaders to integrate, cultural competence into substance misuse preventions, or I like to say cultural proficiency, because that's where the National Center of Cultural Competence has transitioned to, of looking at proficiency. So there's an array of actionable strategies that we could definitely look at to help address the problem in the community. And the ultimate goal here is to look at ways in which we can promote sustainable change, because sustainable change requires that ongoing collaboration, that dedication from these various interest groups as within the community. And then it also requires implementing, these strategies collectively so that they can contribute to a more resilient and supportive environment to address these root causes to substance misuse.
And Ben, I just want to, if I could say one, family
Yeah.
support programs, I think are tremendous foundations for the work that we're doing, because when you implement those programs and those family-centered programs, you provide support, education, and if we partner with the right people, we can provide resources to the families as well that are dealing with substance misuse. I didn't need, at my age, necessarily substance misuse prevention, but my family needed resources. And because my family didn't have resources, my father turned to alcohol. Had we had resources at that time, whether it meant helping him to find another job or helping with the mental issues that he was dealing with, then things could have went differently. So I encourage, of course, the open communication with families about substance use and mental health from prevention professionals from that perspective. Talk to the family. So we do a lot of work with the kids, and I think we need to do more work with the families and finding out what the true needs that they have are, and then working with our community and collaborating so that those local nonprofits that do fill the gaps, and those religious organizations that have the storehouse for the community, and those community centers that they can help amplify the prevention efforts that we're trying to produce. And we can pool our resources and create a united front against substance misuse.
Yes. Definitely agree. Definitely agree with that. It's in my opinion, it's definitely an all hands on deck type of mentality, and for us to build those strong, healthy, happy communities, everyone plays a vital role in trying to promote that overall health and overall well-being. So we want to make sure that if we're looking to work with those families and parents and things like that, we want to make sure that they're at the table. And I think sometimes in our coalitions and groups, we get the parents at the table that already get it. They already understand and they're already a part of the solution. But how do we get to those parents who are not at the table, who are, of course, they might be busy with work, but how can we support them and support their family? Because we understand that they have to work and they have to do these things to provide for their family. But how can we support the family and ensure that there's some protective factors around that family, in case a situation happens related to what Derek has been sharing with us.
So as we come to a conclusion, and we covered so much, I want to ask you, and we're going to do a poll right now, but what upstream solution would you use as a prevention professional to deal with this problem? Would it be advocacy for policy change? Would it be community education and capacity building? Or would it be collaboration with community partners? What would you use? What do you think is it? Because prevention is local. You know what's going to work in your community based on the relationship that you have with your community, based on the resources that you have, based upon the people who are living in your community, and based upon the history of the community. So I ask you, what upstream solution would you use as a prevention professional to deal with this problem? And the problem is we have to provide more equitable services that address the social determinants of health in the context of the work that we do already. Okay, everyone is pulling me into the poll. Thank you so much for participating in the poll. For those who can't participate in the poll, then during the Q&A session, then we'll give you the opportunity to open your mic and talk a little more then, or you can do it in the chat. But I appreciate those who are participating in the poll now, because we want to know what you plan to do, and more importantly, as a PTTC, we want to look for ways that we can help and support you in doing so. We're going to end the poll right now. Take a look at the results. Ben?
All right. So majority said community education and capacity building.
Okay.
And then followed by collaboration with community partners.
Yes.
As well as, and then there was some that definitely advocacy for policy change. So we had about 46% for the community education and capacity building, 37% around the collaboration, and then 18% for advocacy.
And that's reasonable. I mean, advocacy for policy change is that hard road. And we have several workshops that are coming up from the PTC where we're going to deal with that policy change. And we even have like a small micro academy that's going to be coming up. But we're looking at that on a bigger, because that's one of the areas as prevention is that's where it requires the long-term work, but that's where we get the most bang for the work that we do. But we also have the most limitations in that area on what we can do.
Yeah.
So always being safe and secure on the work that we're doing. Okay.
All right. Okay. So just to kind of wrap up our objective 3. So we definitely looked at evidence-based strategy, substance misuse prevention activities that can help reduce those social determinants of health. And then we also share some actionable items or actionable strategies that can be utilized. So to leave you with this, quote, because we always like to talk about collaboration and the importance of not feeling as if we have to do these things by ourselves. It's definitely a collaborative effort. It's definitely important to identify those key players and those key influencers in our community that can help, facilitate and move the needle on some of these topics. So um, so I'll leave you with this quote from Andrew Carnegie. Teamwork is the ability to work together towards a common vision. So the ability to direct individual accomplishments towards organizational objectives. It is the fuel that allows common people to attain uncommon results. And so I always feel like we can definitely accomplish more together than in our silos. And sometimes we speak about those silos and being, not really connecting with the right people. And so we want to make sure we break down those barriers, open the doors for collaboration, networking, and build a stronger community. Because it's definitely, as far as dealing with substance use, whether it's opioids, whether it's underage drinking, whether it's whatever the presenting problem it may be, whether it's we can only get through it together. So yeah, I wanted to leave you with that thought. Yes. And also I saw a question in the chat from Meredith about creating a prevention program for parents. What could be a first step? I would say that you might want to, well, my recommendation would be to, if you have a certain group of parents that you're looking to work with, is to try to see try to figure out what their needs are, and figure out, what the potential needs are, and then utilize some of the resources that the PTTC has in regards to like the federal registries, um, to identify evidence-based interventions. And it's a couple publications out around selecting evidence-based interventions. So utilizing particular criteria to help you find best fit interventions to address various populations. So I think that might be a good starting point. And then, yeah, so Emily said it already, checking out existing evidence-based programs, because there is a lot of different information out there on the web, uh, that could, particular place that I go a lot is Blueprints, which I know Derek and others probably use a lot as well.
Ben, I have one question. The last question I want you to answer, and that's first of all, they said thank you for an amazing webinar. But what would be your recommendation in addressing prevention and harm reduction surrounding cannabis use in the states, and that have medicinally or recreationally legalized it? And
Yeah.
that's a whole webinar right there. But if you could give
Yeah, yes, it is. So living in the state of Maryland, a lot of you or some of you may know we just legalized cannabis for recreational use as of July the 1st. And so, as a preventionist, my argument has always been, because I've seen since July 1st, they have broken record numbers every month in regards of revenue for the state of Maryland as far as cannabis sales. And so my argument has always been, has there been a plan put in place to allocate some of those funds towards prevention efforts to educate persons under the age of 21? Because we know that it's still a substance. We know it's still a mind-altering substance. We know there's still challenges related to that substance, but the policymakers and legal makers, you know, persons are always looking at, oh, well, we can make this amount of revenue from this. And I think we have to take a lot of what we learned from tobacco and utilize some of those strategies and some of those ideas in regards of addressing, cannabis, because I think that of course, the research around cannabis is still young because, of course, it has always been federally illegal. That I think more research is going to come out about some of the, health effects that are related to, habitual cannabis use. And I think leaning on that evidence and that research is going to be good for us, moving forward as preventionists. Because I think at the end of the day, we still have to work to address the public health challenges, even though they're, receiving the benefits off of the revenue.
With that said, we have to close because we always close on time. And as we come to the close of our Social Determinants of Health webinar, I want to express my deepest gratitude to our presenter and to each and every one of you for your active participation, your insightful questions, and your unwavering commitment to understanding and addressing the critical issues surrounding the health disparities. I want to leave you with something positive also. The disparities we've examined today are not inevitable. They are products of the system, structures, and they can be reshaped through advocacy, education, and a shared commitment to justice. A great example is in our lifetime. Remind you about on February 25th in 1990, when I was only 19 years old, the no smoking sign was permanently lit on the U.S. domestic airline flights for the health of flight attendants and passengers. And this eventually led to smoke-free air on all flights to and from the U.S. and the smoke-free policies for airlines worldwide. 2015 marked the 25th anniversary of that important public health achievement. And it was made possible by a broad coalition of health groups, incredible legislative champions, and tenacious flight attendants who were willing to speak up publicly for their right to breathe. Each and every one of you have that same tenacity within you. So let's continue the conversation, challenge the status quo, and work together to dismantle barriers that impede equitable access to health resources. Remember, the change we seek begins with each of us. Thank you for being a part of this vital dialogue. Stay inspired, stay informed, and let's build a future where everyone can attain their highest level of health. Wishing you all continued success in your endeavors toward a healthier, more equitable world.